Today I'm going to talk about stages of labor, the signs of delivery. The delivery and labor usually happens between 37 to 40 weeks. So this is the normal time of labor. If the delivery or labor happens before 37, it's called preterm, and it is above 40 weeks, then it's called postterm. So this is usually a normal time of having a labor. So usually mother goes into a labor, and the average national rate is 38.2 weeks. Okay, so the one of the reason the mother goes into a labor is a decreased progesterone hormone. The progesterone hormone is actually a pregnancy hormone, and it keeps the uterus relaxed. So whole delivery it will not let the uterus contract. So it keeps it in a relaxed position. So when the labor comes near, when the time of the labor, the amount of this progesterone is going down. So when it's going down, then she starts getting a contraction. That's what we say there is a Braxton Hicks contraction. So she kind of feel little contractions in her uterus. So that's one of the sign that she's getting ready for the labor. The other sign for the labor is the lightening. So in this case, what happens, the fetus head, if you see here, this is a pelvis uterus, the fetal head actually slides down, and she feels some relaxation in her respiration, seems like that it's going down, right? So that's called a lightening. So that's the time labor is coming. And there is a third sign which is called bloody show. So normally the female has a mucus plug in her cervix. That happens during pregnancy, and that keeps the infection away, so the bacteria cannot enter into the uterus. So there is a little mucus plug inside the cervix. So it's kind of a blocking the way for bacteria to go up. So that actually comes out, right? So when she start dilating, so it comes out. So you can see as a little mucus with the blood, which is called a bloody show. So these are the signs happens just before the labor pains. So in a labor, so basically when we are saying labor, we are talking about the uterine contraction, and we are also talking about the effacement and dilation. Because if the contractions are happening without the effacement and dilation, that's not a labor. So labor has to have all those three things, contractions, effacement and dilation, and then we'll say okay, she is progressing into the labor. There are three stages in the labor: first stage, second stage, third stage. First stage is all about dilation and effacement. In this stage, she starts from the zero dilation or zero effacement, and she gets into a complete dilation, which is 10 centimeter, and complete effacement, which is 100%. So effacement is also always in a percentage, right? So 100% is the maximum, and dilation is always in a centimeter, which is 10 centimeter is the maximum. So in a first stage, she's going from, there is a three phases in first stage of labor, which is a latent, active and transition. So in this first stage, she is going from 0% effacement to 100% effacement, 0 centimeter dilated to 10 centimeter dilated. After it is fully dilated, in a second stage, starts from 10 centimeter to the delivery of baby, and third stage starts after the delivery of baby to the delivery of placenta, right? The first stage is divided again into latent, active and transition. Latent is like, it's kind of not so much pain, it's only dilated like 0 to 4 centimeter. Contractions are very irregular. Contractions are usually coming between 5 to 30 minutes, and then it lasts about 30 seconds, right? So let's say it's every contraction coming after 20 minutes, and usually it will last about 30 seconds. So that's what it happens in a later. In an active stage, the os will dilate it about 5 to 7 centimeter. So it's now progressing. Contractions becomes more regular. If she walks, she gets more contractions. So we make her walk, right? So it progresses better. And then usually the contractions occurs every 3 to 5 minutes. Here what we were talking about, 5 to 30 minutes. So it's every 3 to 4 minutes the contractions are happening. And usually they last for 1 minute, right? So it's a little bigger. 1 minute means 60 seconds, right? That's what the contractions are going to last. And then we have, after this, it's quite painful. She started having a lot of pain, and now she goes into a transition phase when her os is about 8 centimeter dilated. So 8 to fully dilated, that's what is the transition phase. Very intense contraction, very intense. It's better to give her pain medication during active stage, otherwise she's going to have so much irritation. She doesn't want to talk about something, she just so irritated because of pain if she does not get any pain medication. Her contractions are happening like 0.5 minutes to 2 minutes, like, and then it lasts about 60 to 90 seconds. Normal contractions are 60 seconds. 90 seconds are considered not normal, but it's allowed during transition phase, because sometimes her contractions goes little longer because the baby is coming with the contraction, right? So it may be little longer. So that's the time when the baby comes out. And this is the time, if for example amniotic sac hasn't ruptured before, now it's going to rupture in a transition phase. And in this phase the effacement is 100%, 10 centimeter dilated, baby is out, right? That's what the maximum is. And then from after the second stage is actually starting from 10 centimeter to baby's delivery, right? So that's what it is. So that's what the second stage is. When the baby comes out, then the third stage starts, that's the placenta expulsion. Okay,